Hi all. Today we are going to have a discussion on COVID in pregnancy. This is very apt in this scenario where our COVID numbers are exponentially increasing and very drastically. Many might have lots of questions, especially those who are pregnant. They might be worried, not knowing what to do. So, this is a session where we aim to answer few questions. And most commonly asked questions, what I have thought is we put forward as the questions and we can discuss around those things. So, we will try to understand what is COVID and try to answer most of the commonly asked questions. So let us go into the detail of COVID in pregnancy. Next slide, please. So the moment we tell, yes, I have a COVID and I'm pregnant, many people will have these two, three questions in mind. Are we going to get the COVID more than the others? Or is the chance of getting COVID same like anybody else? Or am I at increased risk if I'm pregnant? So you are not at very high risk just to get a COVID because you are pregnant. In population, whatever is the chance of you getting COVID, you will have the same chance as anybody else. So, pregnancy does not increase your chance of getting or contracting COVID from others. You are as likely as anyone else. So, is it more severe if I'm pregnant? Is the same COVID infection, is it more severe? Some people will feel that it might be a little worse, but most of the time, that in the last first and second waves, what we have observed, very few will have more severe infections. Most of the time, 80 to 90% of pregnant women, when they have COVID, either they are completely asymptomatic, means they don't have any symptoms, or most will have very mild flu-like symptoms and they come and they go, like cough, cold, fever, sore throat, loss of smell, taste, few of these that anybody will expect in COVID. They will have mild symptoms and it will go. But very, very few women will have more severe infection. That is also something very similar to the general population. Like, not everyone who has COVID will be hospitalized in ICU. So, only very few patients will need more medicines, more hospitalizations, and lots of damage done in the body. The same thing applies for pregnant women. It is not more severe just because you are pregnant, but sometimes, some day in and day out, we see some women will be getting more complications, but not all. So don't think that the moment you are pregnant and you get COVID, you are going to have a very severe infection. Not all the time. And is it bad if I am in the last 3 months of pregnancy? Anytime in pregnancy, it is not nice to have a COVID, but last 3 months, it is not definitely going to say that it's very bad because you are in the last 3 months. But if you have symptoms, you might feel more of it when you are in the last 3 months. Already in the final stages of pregnancy, you feel quite short of breath. Normal walking for some short distance only, the lungs are not up to, and you feel quite tired and breathless. So the moment you have symptoms like a cough and shortness of breath, that symptom severity might be a little more remarkable when you are in the last 3 months. But just because you have a COVID in the last 3 months of pregnancy, it is not always very severe. It is not always dreadful. So let us see what next other questions that women will have. Next slide. So the next thing is, okay, I might not have a large symptoms. I might be feeling fine, no problems. But what about my baby? I have COVID. Will I have the baby affected? We have seen in the first couple of waves of COVID that the likelihood of babies getting COVID is very, very less. Like in studies, they have done like tested all the babies. So even though they have tested more than 50 babies, it's only one baby who had the positive, others are all negative. So it's very less common that babies will have the COVID transmitted from mother to baby. So we have also seen that the virus is not isolated in vaginal secretions, it is not isolated in the breast milk. So most of the questions that, okay, can I have vaginal delivery? Can I have feed my baby? All these questions will be answered because we have not isolated the virus. We should not restrict any form of delivery, any feeding the baby or anything. So the main thing is it is not directly transmitted or very very uncommon for baby to get from mother when the baby is inside the womb. We have not seen very high chance of miscarriages or anomalies for the baby when you had COVID in the first few months of pregnancies. But the chance of miscarriage in a normal pregnancy is also high. But it is not extra just because you have a COVID. We have not seen so far that there is a very high chance of abnormalities in the baby or miscarriages. But what we have observed is women who have COVID are more likely to have high blood pressure in pregnancy later on, or premature delivery, like preterm delivery, delivery before completion of 9 months. So we have observed that prematurity is a little more common in COVID positive women. And sudden deaths of the baby inside the womb is slightly higher than general population. So this is the only things that we have observed in COVID population, COVID positive pregnant women. But it's a slightly higher chance doesn't mean that everyone will have the same problems. But we need to be a bit watchful of these problems and we will monitor in that sense. And there is no indication that, the moment the first 3 months, if someone has COVID infection, they come and ask, oh my God, I'm so worried that I want the termination of pregnancies. It is not so. It is not a medical indication for termination of pregnancy because we have noted that there is no extra risk for the baby in view of anomalies or miscarriages. And so we feel there is no medical need for a termination of pregnancy. Okay, next slide, please. So let us see in form of a few scenarios to answer most of the commonly asked questions. The main, like first scenario, let us see. If I'm a pregnant lady, I had contact with infected person. Now, what should I do? Should I get tested for COVID or not? So first thing we have to see is how significant is that contact? Who is that person you were in contact with and how much of contact did you have? So what is significant contact? If your family member is infected, that means you will be staying with them all the time and you might be in less than 1 meter distance to them and you are exposed to more than 15 minutes, then it is called significant contact. You are in an office sharing a space, but it is open space. You are not within 1 meter distance and you are not in the same closed space of less than 1 meter distance for more than 15 minutes, then it is not a significant contact. So some will say, okay, I have a maid who came and worked, but she was positive. But if this is what you have to see, were you in contact significantly with that person? So were you in less than 1 meter distance without mask for more than 15 minutes? If so, yes, you are likely to get infected, so you can get it tested and isolate. But if you are a person who has not had this contact so significantly, then don't worry. And if you have symptoms, that's a different scenario. Next slide, please. So to answer the same question, I have summarized. So first evaluate whether the contact was significant or not. If it is significant contact, isolate yourself and get the tested. When you are in isolation but you don't have symptoms, in that 4 or 5 days you might develop symptoms. So when you are isolating, you are waiting and seeing whether you will develop symptoms or not. If you don't have any symptoms in that 4 or 5 days of contact, then you can just get a retest and go back to work. Okay, next slide please. Then comes to a next commonly asked question. Now I have mild symptoms. I might not have fever, or I have fever 99 degrees, or I don't have cold but I have some dry cough. I have running nose but I don't have fever. I have body aches but I don't have cough. So it is not like you need to have each and every symptom that is listed. You have loss of taste and smell, or you have cough, or you have cold, or sore throat, or burning pain, or body aches. So any of these, if you develop, then you have to know what you should do. If you are not terribly bothered regarding that symptoms, fine, you can stay at home, but you have to be isolated and you need to get tested. So let us see. Next slide, please. So first thing is, these symptoms can be COVID till it is proven not. So till you get tested, don't think this might be okay. I have had a cold drink yesterday, or this is a normal flu. I get all the time some allergies and things. So we don't know. Not all fevers are COVID. Yes, definitely we need to evaluate other reasons for fever. But till we test, we don't know that could be COVID also. So we have to have an open, point and think, okay, what if it is a COVID? Then the right thing to do is to isolate till you get tested and it comes negative. Okay, so get it tested. But if in case it is positive, then and your symptoms are very mild, most of the time, as I said, 80 to 90%, the symptoms will come 2 3 days, everything is gone. So if you are such a person, your symptoms are mild, you are able to cope at home, you have mild fever, you have mild cough, but nothing that disturbs you too much, you are still feeling better and well, then you can just stay at home, hydrate yourself, have good food, don't get in touch with anybody, don't contact anyone, but not virtual, yes, but not physically, and then wait for the symptoms to reduce. If your symptoms reduces, fine, well and good, complete your period of isolation and you can come off isolation. Nowadays, we are not telling to retest also. If your isolation period is complete and you are absolutely fine, no fever, no symptoms, then you can just come back. If you are working, come back to work, or if you are like come off the isolation. But if your symptoms persist or getting worse, then you need to contact your healthcare provider. Then they might suggest admission or observation. Next slide, please. So let us take another scenario and see. Now I have, I feel very unwell. I have high fever. Fever can be measured thermometer, and if it is Celsius, it's more than 38 degrees centigrade is considered high, or more than 100.4 is also considered high. And fever is not reducing. It is 1 2 days of fever, but it's not coming down. I'm taking Calpol regularly, but it's just not coming down, and it's very high temperatures. Or I'm now developing respiratory symptoms like a lot of cough that you are not able to settle with the normal cough syrups, or you're getting short of breath, you feel wheezy, and it is difficult for you to hold the breath. Then, or you have other comorbid situations like your age is more than 35, or you're obese, you have pre-existing conditions like diabetes, high blood pressure, heart disease, less like autoimmune conditions. These are the things that increases the risk of you getting severe disease. So if you have some situation like that, please get in touch and you need to be in the hospital. Or when you are measuring your pulse oximeter, oxygen saturations, when you are doing at home, if it's showing less than 94, that is not normal. This is the time when you have to be in hospital. So know when you have to be in hospital, and you can be at home if you don't have any of these features. Okay, next slide, please. So if you have that severe symptoms, or symptoms not reducing even after 1 week, or you are feeling unwell with it, or tired and no energy, then you are not like not simple viral infection. That might be a little severe disease, or your lungs may be affected badly. So in such situations, you are better in hospital. You might need CT scan. In pregnancy, there might be a lot of worry for many people if they need to get a CT scan. Routinely, for every pregnant lady, you don't need a CT scan the moment you have COVID positive. But if you have symptoms, if your symptoms are not reducing or you have high risk, then you will be suggested to have a CT scan. Don't worry if you are needing a CT. Don't worry about the baby. We can just put a shield and do a CT. In such situations, doing a CT is more beneficial than harmful. So we have to weigh the risk and benefit, and it is always benefit will be more than risk to the baby. So in that situation, if CT is advised, get the CT done. And mother and baby will be monitored when you are in hospital. Some blood tests will be done to look at every organ function and clotting ability and everything like that. And then you might be given some medications. That medications, we have now nice protocols that are there, all international and national protocols that are available. So almost all hospitals will be following the similar protocol. It is now more awareness is there. Many people know exactly what medications have to be given. So don't worry if you are to be in the hospital. Okay, you will be in the hospital, but you will receive medicines as per the protocol. Next scenario. Next slide, please. Now, completely a different scenario. You are now in isolation, but you are due for a normal, regular pregnancy checkup. So, what should I do? Should I come for scan? Should I come for a checkup or not? If you are in isolation, then first thing is try to contact your healthcare provider. You might be somebody who is requiring scan for a different need. Like not everybody. Some will have a regular routine scans. Some will have needed scans that we really need to monitor the baby. So we are advised a scan. So that it will be individualized whether you will require um, any assessment at that time despite you having COVID or despite you are in isolation. So if you we are worried that no, we need to get the baby monitored or whether we need to check you, then we don't worry. If your doctor feels that you need to be seen or checked, please tell them, because you will be seen differently in a in a isolated environment. When you are needing a checkup, you'll be separately seen, so you will not get in touch with other pregnant ladies or other people who might get affected by you. So always make sure that when you have to come to hospital, you have to go to that isolated place where they all suspected people will be seen, and it's all different and in an isolated environment. And if scan has to be done, it will be done, but that scan machine, everything will be sanitized after the use, so later they can be used as normal for others. So that schedule of appointments will be in such a way that it can be planned for you if you need to be seen. And in emergencies, like suddenly you are not feeling the baby movement and you are worried, obviously you need to come to hospital. Till then, we will not be able to assure you that you are fine or baby is fine. In such scenarios, we just call before you come, or when you come to the emergency room where there will be an isolated facility for checking suspected COVID or COVID positive people, and everything will be done as per the need. Next slide, please. So if it's a routine scan or a routine visit, sometimes we postpone till that 1 week of isolation, till that 1 or 2 weeks. But it depends on your scenario. So it will be very, very individualized. If you are fine, baby is fine, movements are good, and the doctor or your midwife can say you wait for the period of isolation. But if you have concerns with the baby growth, or you are a very high risk person, you have diabetes in pregnancy, you have high blood pressure in pregnancy, we need to discuss and then we can schedule. Next slide, please. Next scenario, if we are COVID positive and I don't have any symptoms, I feel otherwise very well, and now I started to have labor pain. So what should I do? Should I come to hospital? Should I try for normal delivery? Should I have a cesarean as a routine? Will there be any harm for the baby if I am COVID positive and I'm in labor? So these are the very common questions again. So let us see. Next slide, please. So, if you are in labor, we prefer your delivery to be done in a tertiary hospital. If you are feeling very well and you have a very low risk pregnancy, no problems at all during pregnancy, or no objections raised by your doctor, then you can be in the at home when you are in very early labor, when you are not sure whether labor is establishing or not. We are able to feel the baby, water is not leaked. You can be at home till your contractions increase, your pains are increasing, that you think no, I need pain relief, or they are coming coming very regularly, more than 2 times in 10 minutes, then we ask you to come to hospital. Call before you come and tell that you are positive, so you will be in a different, the labor room and area will be designated in a different scenario and place for you to be cared for, and the person who is taking care of you will be in the appropriate personal protective equipment, and we have to assess you and then sometimes make the decision of which is the safer mode of delivery. If everything is going fine, there is no restriction for you to have whichever mode of delivery, whether it is a normal or a cesarean. The indications for normal and cesarean will be as usual before, but sometimes that judgment will have to be individualized depending on your scenario. See, suppose if you are having respiratory problems and it's too much that you can't breathe properly or your oxygen levels are going down, then labor might be very difficult for you. Then we might take the decision of a cesarean section. But that is very highly individualized. But we cannot take it as a blanket rule that every COVID positive mother, when you are in labor, you should have a cesarean, or everyone will have a normal delivery, whatever the COVID severity be. So, like we have to be a little open and individualize the decisions. Epidurals and pain reliefs, there is no major contraindication. Like we should not say that no, I cannot give epidural because you have COVID. I cannot give you this injection because you have COVID. Normal pain relief options can be used, but we are a little. We had this problem of using gas and air. If you have to use a gas and air, obviously you will not be having mask. So we have to be a little judgmental and cautious here when you are using gas and air. But injections, pain relief methods, epidurals, no problem. We, as I said, we have to individualize the care and management when you are in labor. Next slide, please. So, and then, okay, after delivery, now you have COVID positive, now, but you are breastfeeding. So, what should I do? Can I feed my baby or not? Will I need some extra precautions, or can I continue breastfeeding, or should I separate myself from the baby? So, these are the questions which were had different answers as COVID evolved. Initial stages in the first wave and second wave, lots of separation was there between mother and baby because we didn't have the studies, we didn't have the proof, so we were not sure whether the baby will be infected from mother or not. So isolation was practiced, and it was very difficult, and lots of people had coping problems and bonding problems with mother. And it is not easy if the other person who is feeding the baby should be well, and it's very difficult that if the sanitizing procedures for the breast pumps and everything, if it's not followed, then there is no point in having a separation. Instead, now we've realized more and more that instead of separating mother and baby, follow the precautions like follow hand hygiene, appropriate hand hygiene, put the mask on, and then feed the baby. Then babies are very, very unlikely to get COVID from you if you follow all these precautions. And even if the babies are getting positive, they are having no symptoms at all and so mild that it will not even feel that they have suffering. So I think at this moment of time, we are also telling that you can practice rooming it. Just follow precautions, but feed the baby. Breast milk, we have not isolated the virus. So you cannot give COVID to the baby through breast milk. Breast milk is always fine, but it is through you. Sometimes it's the mask, and we also tell that you have to put the mask, but don't put mask for the baby. Baby can be suffocated. So always not mask the baby, but mother has to put the mask or whoever, and extra precautions because now it's a COVID time. It's always a celebration time when the baby is born. You have all the family members, extended family members coming and visiting and seeing the baby. I think these practices, I think we have to hold on for some time till the COVID wave reduces. Try to limit the number of people who are exposed. So thereby you will get more protection for the baby rather than separating baby from mother. So hopefully, I think there will be so many questions and answers. Hopefully we have answered the most common questions. I will be open for any further questions. And always, always, before I take a leave, vaccinate. Vaccination is the key. If anyone is there not vaccinated, please complete your vaccination. At any point in pregnancy, it is safe for a vaccination, whether you are in first 3 months, second 3 months, last 3 months, feeding, any time is a safe for the vaccination. So complete your vaccination and you are less likely to have more severe disease if you're already vaccinated. Thank you. Any questions?